Hi, my name is Charles Nagy. I'm a consultant obstetrician gynecologist at Medcare Women and Children Hospital. I am the head of the Medcare Endometriosis Center and the minimally advanced laparoscopic surgery. Today, I would like to talk to you about a very important subject that is the source of lots of confusion and anxiety amongst patients. And also, in late years, it has caused a lot of debate between doctors about the management. This subject is uterine fibroids. So what are these uterine fibroids? How they develop? What kind of symptoms they cause? How do we diagnose it? And how do we approach management? First of all, in order to understand what are fibroids, these are solid tumors, smooth muscle tumors. If we imagine the uterus is like a muscular organ, it's formed of three layers. The inner layer, that's the lining of the uterus. The middle layer is the muscle of the uterus, and the outer layer is what we call the serosa. The fibroids, uterine fibroids, they arise from the muscle of the uterus. Research has shown that they arise from certain cells called stem cells. These cells are able to divide into more muscle cells, collecting also some material around it, causing it to stick together and form like a rubber ball. This is exactly what fibroids are. So fibroids can have different sizes and different locations in the uterus. They can range from less than 1 gram to many kilograms in weight. They can range from a few millimeters to many centimeters in size. They can be singles, they can be multiple, and they arise in the uterus, but sometimes we see fibroids completely outside the uterus. So how common are these fibroids? Fibroids are very common. Research has shown that 1 in 3 women can have fibroids. But in certain races like African American women, it can be up to 50 to 80%. So it is the most common benign reproductive organ tumor for women. This is why we have to be very careful when we start diagnosing the fibroids. Not all fibroids need treatment, and when we plan the management. So what are the risk factors? Having had fibroids, we don't know how they arise, but we know that the older you are, the more chances you will present with fibroids. Obesity is linked to fibroids because of the level of hormones, estrogen and progesterone. Also, hereditary factors like your genes. It runs in families, so if you have a relative, mom or sister who had fibroid, you most likely may have some fibroids. Factors like high blood pressure, it can also be linked to the increased incidence of fibroids, and some dietary factors like consuming more red meat, vitamin D deficiency, and also what we say high carbohydrate diet that will make you overweight, that increases your risk of fibroids. So what are the symptoms? Fibroids can go silent for many years. So they can cause no symptoms. But when they start to cause symptoms, this is when we see the woman coming with a certain problem. But when we talk about asymptomatic patients who don't have any problem, they shouldn't be worried about fibroids. But then here comes the importance of regular checkup. Like every woman should have a yearly checkup to find out whether you have fibroid, whether you have anything else like the pap smear. Symptoms that can present that we see very frequently in clinic is abnormal heavy menstruation, sometimes bleeding in between the periods, and sometimes persistent bleeding all through. And that's serious, and that brings the attention of you to go to the doctor. Sometimes women come with completely different symptoms like unable to return urine or going to toilet very often. That's from the size of the fibroid pressing on the bladder. Some women also come with pain, either pain from the fibroid pressing on the pain in the abdomen. That's the first sign they know that they have fibroids, and when the doctor examines them, then they find out that they have this problem. And as I said before, some women present with no symptoms whatsoever. So how do we diagnose it? The most important thing, as we said, is the regular yearly checkup, because many women will have no symptoms whatsoever. Then comes the role of ultrasound scan. Very simple, the doctor can do it in the clinic or in the radiology department. They'll find out that you have fibroids, and then we will start the journey of discussing whether you need treatment or not. Some diagnostic modalities like magnetic resonance imaging can be very helpful in locating the location of the fibroid, the number, and the size, which will definitely help your doctor to plan the management. Other things like injecting certain dye into the uterus, a procedure called hysterosonogram or hysterosalpingogram. This comes actually during the route of investigation for infertility. This procedure will highlight the shape of the uterus and if you have fibroids. To know about the location of the fibroids, now fibroids can be inside the uterus or outside the uterus. We call sometimes subserous, that's bulging outside the uterus, or submucous if it's bulging inside the cavity of the uterus, or it can be still within the muscle of the uterus called intramyometrial. Now, fibroids are known to cause sometimes infertility, but not all infertile patients, they have fibroids. Only 10% of infertile patients or patients with delayed having kids, they have fibroids. And this is why we have to be very careful in finding the reason for infertility. So the couple will have to go through rigorous investigation for infertility before we decide that fibroid is the reason. A fibroid of 2 centimeters outside the uterus is very unlikely to cause any problems. And this is according to a Cochrane review that has been published. But the same fibroid, if it is very close to the fallopian tube, it's very likely to block the fallopian tube, and this will cause infertility. So it's not only the size of the fibroid that decides the fertility impact, but also the location and the number. Treatment of fibroids, as I said, it depends on whether it is creating symptoms or not. So patients who had kids and incidentally found to have some fibroids, you don't necessarily need any treatment if you don't have any other symptoms like heavy periods or any pressure symptoms and you have like few small fibroids. You don't need treatment. Treatment can be medical or surgical. Medical, we need to treat if there is any associated anemia from the bleeding in order to improve the outcome of any surgery. Medical treatment can also involve giving you some injections to stop the hormones from the ovaries that feeds the fibroid and increase the size of the fibroid. But in most cases, actually, this medical treatment is associated with recurrence once we stop the medical treatment. These injections are given monthly for a period of 3 months. We give it to patients before the surgery sometimes to control the bleeding and shrink the fibroids a little bit. There are also some tablets like a product called Esmia, and it has been shown to shrink the size of the fibroids and bring about some improvement of your symptoms. Apart from the medical treatment, when it comes to surgery, we have to individualize the management. As I said, not every patient will need surgery, but removing the fibroids is the gold standard for treatment. It is the 100% cure once we remove the fibroid completely. Surgery is indicated if you have symptoms, like if you have proven infertility due to the fibroids, if you have heavy bleeding from the fibroids, and we shown that because of the size of the fibroid, the location, they cause bleeding, then surgery is indicated. Also, if you have big fibroid causing pressure symptoms in your bladder, on your bowel, chronic constipation or pain, then surgery is indicated. Surgery in most patients, once we decide that, can involve removing the fibroids either by a laparoscopic technique as we normally do at our center. And it doesn't matter the size or the location of your fibroid. So we can remove any size of fibroid and any number of fibroids. But also we have to individualize that according to your symptoms according to your age, your fertility needs. Sometimes we may decide that the open technique is better for you, so we will proceed that way. Okay? Some other techniques that has been advocated also is what we call uterine artery embolization. When we block the blood supply to these fibroids, they shrink over a period of weeks after the procedure. And it can be effective in certain patients, but we don't recommend it for patients trying for a baby because it can have some complications like inadvertent blocking of the blood supply to the ovaries, which can be very serious. Other technique that you may hear about is MRI guided ultrasound waves. It's a non-invasive technique that has been shown in some patients that can shrink the fibroids. So we focus the ultrasound waves on the fibroid using the MRI monitoring. Again, it can be good, but not every patient is suitable for that. We can remove fibroids also through a non-invasive technique through the neck of the womb. We dilate the cervix, and if we can see that fibroids bulging completely into the cavity, we can remove it there and then, and this improves significantly your fertility. So, as I said, fibroids are benign, that's not cancer, and very rarely to turn to cancer. This is why not all patients will need certain treatment. If you don't have symptoms, don't worry about it, but do the regular checkup so that your doctor is aware of the size of the fibroid. Any increase in size, he will alert you that we need to do some action. And as long as it doesn't have any fertility impact, there is no need to worry about it. And this is all about the fibroids. Now, if you have any questions, we're more than happy to answer you. And I'm going to introduce my colleague, the head of marketing at Medcare Women and Children, Kimia. So welcome, Kimia, if you have any questions for us.
Good afternoon, doctor. Thank you so much for joining us for this very important session. And like you mentioned, it's one of the very common things that we see in nowadays amongst women. A few questions that we've been receiving and that we've got. Can fibroids multiply?
Thank you, Kimia. Once again, I'm Charles Nagy. I'm the head of Medcare Endometriosis Center and Minimal Access Surgery. Fibroids can be multiple, like many fibroids. Sometimes the fibroid is connected to the uterus with a string of tissue called a pedicle.
Okay.
So for the patient, she can feel it sometimes on the right side, sometimes on the left side. But fibroids don't move because they need blood supply mainly from the uterus. Okay. They don't migrate, but sometimes patient feeling can be different.
Okay. Are there any specific reasons why fibroids happen? I mean, other than, it's just a thing that happens. Is it something to do with your food or your lifestyle or, within your genes, something that you probably are carrying forward?
We don't know the exact reason for fibroids origin, but we do know that there is genetic element, especially in certain races, that increases the incidence of fibroids. The genetic elements sometimes control the factors called insulin growth factor. This is the factor that stimulates the certain cells in the muscle of the uterus to divide in an uncontrolled fashion and form lumps of muscular tissue. Also, there is something called extracellular matrix substance that sticks the cells together and form this rubbery feeling of the fibroids. These substances were found with increased level in patients with fibroids. The diet, yes, it has a role. It's not a direct one, but it's very important. Consuming more red meat, vitamin D deficiency, unhealthy lifestyle in general will increase the weight, and the weight is linked to increased level of estrogen, and that feeds the fibroids. Okay. So yes, definitely it has an impact, although we don't know the reason, but it's more common in women who are obese and of a certain race, the African American, okay, and also in the Middle East.
Okay. So having said that, I mean, so people who probably have got some preconditions like diabetes or hypertension, are they more prone to it?
Certainly, yes. They found people with high blood pressure, they have more incidence of fibroids. And also patients with diabetes, they tend to be overweight, and this is linked to the increased incidence of diabetes. although it is not direct reason for it.
Okay. You also mentioned in what we spoke right now about how the fibroids can be inside the uterine wall and outside as well. Is there any pain in terms of how the severity of the pain? Is it more because it's outside the uterine, or is it inside? Does it make any difference, or it
This
doesn't
is
matter?
a very important question. Sometimes the fibroids, if they are within the uterus, so every time during the period, the uterus is a muscle and it contracts, and this can cause more severe pain during the period. But it depends on the size and the location of the fibroids. As fibroids grow bigger, and when we talk about big fibroids, we're talking about sizes above 5 centimeters.
Okay.
So the more bigger the fibroid, the more likely it will cause symptoms of pain.
Okay.
And also the number of fibroids. So a woman with a small fibroid, just one fibroid, is unlikely to have any symptoms of pain compared to a woman who has 20 or 30 fibroids of bigger size, more likely to have pressure symptoms and pain.
So you did mention about how we undergo surgery to remove these fibroids. If like you said right now, a woman might have 20 fibroids or a large number of fibroids, can all of it be removed in one surgery, or do they have to go through multiple surgeries?
A very important question. It depends on the indication for surgery.
Okay.
We have to take into consideration the patient age, the fertility needs, and the symptoms.
Okay.
So this is when we decide the surgery. As I said, we can remove any number of fibroids using the laparoscopic technique or the minimally invasive technique. But for some patients, sometimes they choose the open technique when we'll be able to remove all the fibroids. We can remove it all through laparoscopic technique as well. But cosmetically, some patients don't prefer multiple punctures and they prefer one single. But if we look at the outcome, they're both equal. However, with laparoscopic technique, it is better because quicker recovery, less complications of adhesions. Adhesions means tissues sticking together. So less impact on the fertility, and quicker the patient will start a family.
Okay.
So it has got so many advantages. But again, it depends on the experience of the doctor and the indication for the surgery. Okay. So any number can be removed laparoscopically.
Depends on how the condition of the patient
Yes.
is. Okay. And can they go away automatically on their own if they're small, especially if they're small fibroids, like you said? Can it just go away by itself, or you need to have some medication or some kind of treatment for it?
Fibroids will never disappear on its own, but we know that at the age of menopause, when the level of estrogen is less, fibroids tend to shrink. They will never disappear, but they shrink in size.
Okay.
And some patients feel improvement of her symptoms, whether it was irregular bleeding or heavy periods, or even pressure symptoms. They can shrink, so the symptoms are improved, so they may not need surgery.
Okay. You also mentioned there are certain fibroids that are asymptomatic. It
Yes.
does not have any symptoms, but then suddenly we see people get those symptoms. What leads to that? Why that sudden change? Is it growing on its own, or?
This is an important question. Sometimes fibroids, they cause no problems when they are hidden within the wall or on the outside. But once they start bulging inside the uterine cavity, the woman will start having pain and heavy bleeding because the fibroids started to grow in size. And this is why we said it's very important, once you know that you have fibroids, to have regular yearly checkup with ultrasound scan to monitor the size of the fibroids and whether she's getting new fibroids as well.
Okay.
It is very important, of course. Why suddenly women start having symptoms? Because growing in the size of the fibroids, or new symptoms, or sometimes it's discovered during the routine investigations for infertility, so which is considered asymptomatic, yes, but it's implicated in infertility.
Okay. It's got consequences.
It is one of the consequences, of course.
Okay. Is there an age limit to fibroids? So, for example, if does a young girl not get fibroids and an older, mid-age or closer to menopause is more likely to get fibroids, or is it anybody can get it?
Fibroids are common from the age of puberty up to menopause.
Okay.
But we commonly see it after the age of 30. But we have seen and operated on patients age 16, 17 with huge fibroids. So the younger the age of menarche, what's the first period, the higher the incidence of fibroids, because the uterus is exposed to the level of estrogen from a very young age.
Oh, okay.
The research found that.
Okay.
So, but most patients don't show up with symptoms until it's later in life, unless it's very big. So they can present from the age of 15, 16 up to the age of 45 or even more.
Okay.
But as I said, once menopause, the fibroids tend to shrink.
Okay. So then I think, I'm not sure, but you can correct me if this is wrong. As the earlier the girl gets, or she starts the first cycle, the more regular she should be actually coming and seeing the doctor, so you can actually control the growth of the fibroid.
Once she knows that she has fibroids. But
Yes.
if she doesn't know she has fibroids, it's very unlikely girls, before they get married, they go to a gynecologist, unless they have a problem.
Okay.
I mean, we have girls coming with heavy bleeding, unexplained. We better check and find out whether they have fibroids or not.
Okay.
And we keep an eye. We start with medical treatment. I mean, not necessarily will offer surgery.
Okay.
So regular check is very important. Encourage them for regular check. The doctor will do this very frequently.
Need to
Answer yes. The answer, treat fibroid symptoms from that. If a woman has fibroid, we have problems that can cause health.
Okay.
It is attached to the uterus if they are big within the fibroid in many patients.